So unfortunately, the answer is yes, you can have co-infection with the flu and COVID and have both at the same time. We don't have enough data at this point in time to know exactly what that would mean. But generally speaking, for your body to be fighting off two potentially deadly infections is never a good thing. There's no reliable way from a symptom standpoint to assess whether or not you have COVID versus the flu or one or the other. Because they're both respiratory illnesses, the symptomatology really overlaps. And so the only way to distinguish between the two is to get tested. If you are positive for the flu, you can take antivirals like Tamiflu within the first 48 hours of diagnosis to have the most impact on the severity of illness as well as duration of symptoms. If you're diagnosed with COVID, you may qualify for monoclonal antibody treatment if you're older or have certain chronic medical conditions. That will also help prevent severe illness and hospitalization. So the actual diagnosis really matters in terms of treatment. The last flu season, which was non-existent, showed us just how strong and important certain public health measures are. We don't exactly know what is going to happen this year. We're in a slightly different situation in which individuals are a bit more lax with regards to their adherence to these public health measures. We also have kids back in school, a lot more socialization. So I think that's a big reason why we anticipate we will see flu this year. I think it'll be incredibly important to get the flu shot to both protect yourself from getting the flu generally, but also from a public health standpoint to try and prevent severe illness and hospitalization, which we know the flu vaccine protects against. We really need to maintain our hospital capacity this coming winter to be able to take care of those patients that need the hospital. And if we don't have enough people vaccinated against COVID and the flu, we're worried about what that would mean for our hospital capacity over the coming months.